get a denial that comes in, but we just don't have the manpower to send an appeal out within 7 to 10 days. And so then we're just ultimately accepting that denial and writing it off. And it's like, well, what if you have a whole team of people that are dedicated to you that will write those denials for you, send those denials off, kind of follow up and track those denials? And a lot of people go, that would be such a big help. And then we wouldn't be losing out on that money. What we're doing with BHREV and Opus RCM, we're designing a platform and services that are designed specifically for behavioral health providers. So then that allows us to use within an engagement, once we partner with you, that we can then leverage through Opus RCM cutting edge AI technology to handle like claims faster, reduce denials, improve visibility across our revenue cycle. But then the real results beyond that come from pairing that AI piece with expert human oversight.
To unpack their journeys, explore key challenges, and talk about how they're shaping the future of behavioral health and healthcare technology. I'm your host, Shawn Rickenbacker, and today we're digging into one of the most complex and mission-critical areas for behavioral health providers, revenue cycle management. Our guest today is Alyssa Putman, the expert behind Opus's RCM Services and someone who's helping behavioral health organizations of all sizes take control of their revenue processes. Alyssa has spent years in the trenches of behavioral health RCM and brings a unique perspective on why so many providers struggle with collections, billing, and compliance, and what it actually takes to fix it. Alyssa, welcome to Brainwaves. I'm so glad to have you here. Can you kick us off by telling us a little bit about your background and what brought you into the space?
Yeah, thanks, Shawn. I'm really excited to be a part of the podcast today. As you mentioned, I've been in behavioral health administration, and over time, I kept seeing some of the same patterns with behavioral health providers that I was going in and working with. There were these amazing people that were delivering like really critical services, but they constantly felt like they were in financial distress. And it wasn't because they were providing like bad care. It was because their revenue cycle was broken or unsupported. And what drew me into it was the realization that if we could fix things on the back end, we could help these state agencies stabilize, grow, and continue to serve more people. So that's what makes behavioral health RCM so unique. It's not just about like billing and coding. It's really about making sure like notes are met, that, insurance requirements are met, that things are coded correctly with the right modifiers, and it's become so complex. And once I saw like how misunderstood this got, I knew that I really wanted to dedicate myself to working within like the RCM cycle process. And that's what led me to working with BHREV and Opus RCM. I kind of feel like we're building a system that's designed specifically for behavioral health, and we're here to really help be a lifeline to providers, not just another vendor.
That's awesome. It sounds to me, even just with the short conversation we've had so far, there are a ton of nuances when it comes to revenue cycle management, especially in the behavioral health space. So it sounds like it's really important to have somebody that's an expert guiding you through it, right?
Absolutely. Absolutely. Having somebody there that can like walk through the systems with you just makes such a difference.
Awesome. What inspired you to dive into the revenue cycle of behavioral health? It's not always the first place people start their careers, so what drew you in?
Yeah, like a lot of people, I definitely did not plan on going into revenue cycle in the beginning. But like I said, early in my career, I saw a lot of really mission-driven programs that were just struggling to stay open, or they feel like they were having to make cuts in areas that really would impact the care that they were providing. And so it's not at all because they weren't providing great care. Like I said earlier, it kind of goes back to they had a lot of breakdowns and leakage in their billing cycles. So RCM isn't just about the numbers, it's really about the foundation, setting a sustainability for these agencies. And I realized if I could have any sort of meaningful impact by helping build a reliable and compliant and scalable revenue process, that I really wanted to be a part of that.
Absolutely, that's awesome to hear. Um, So you've worked with a wide range of providers over the years. What are the most common challenges when it comes to RCM that you see early on that made you so passionate about creating a better solution through Opus RCM and of course BHREV?
Yes, so for a lot of the agencies that I've worked with over the years, a lot of the same challenges kept popping up. There were a lot of disconnected workflows, a real lack of documentation training, and a lack of training regarding like payer specific requirements. That a lot found that a lot of teams I was working with didn't know they were even missing these areas. So I was seeing firsthand like these things weren't just financial issues, they were becoming barriers to care and barriers to getting clients access to services. So that's kind of a neat thing about the services we're providing is that we're like closing that gap for agencies and designing our solutions around having around the behavioral health landscape. And because providers need a system and support that actually reflect the unique work they do and is just not rebuilt from a completely different industry to try and fit what we do.
So it's less of trying to find something that kind of works and more of building a solution from the ground up that works specifically
Abs-
for behavioral health.
Absolutely. That's just it. That's the key for it. That's the thing we constantly see. A lot of agencies or providers have these systems that were designed for the med surge care, and it doesn't isn't always applicable to our behavioral health. And that's really what we're excited to be doing and launching.
Awesome. Thank you. How has your perspective on the behavioral health space evolved as you've helped different providers clean up and optimize their back end operations?
Yeah, over time, I gained a deeper appreciation for how much behavioral health providers carry, whether that's emotionally, administratively, and ultimately financially. So initially, I thought RCM was just about like maybe fixing processes, but now, like the longer I've worked with in the revenue cycle, I've realized that it's about like restoring confidence for these providers. So many of the agencies I've worked with have been really operating in this sense of survival mode. And it's not great if we feel as behavioral health providers that we're working in survival mode when we're working with a lot of clients who feel like they're in the same piece. So if we're unsure of what we're doing wrong and how to make it better, it just creates this unnecessary level of stress. So my perspective has come from when you clean up the systems and establish some sustainable workflows, it's amazing to watch the confidence of the teams turn around and go back to that mission focused, mission oriented care that they're providing. So that's just a big piece is cleaning up the whole claims process and the whole billing cycle process. That way we can help agencies build that operational strength that they need and really support the foundation of the services they're providing.
Sounds like revenue cycle management is so interconnected with the rest of operations that it's crucial to have that figured out essentially so that you can focus your time really on helping people.
Absolutely. And that's just the thing is a lot of times when we think about revenue cycle, we just sit it in a silo out on its own. So it's just lingering there. So we're really worried about the care, we're really worried about the EHR, we're really worried about those pieces. And then out by itself is RCM. And that's what gets a lot of people caught up is that RCM is actually integrated in everything we do from day to day. When it's scheduling the patient, making sure we're getting the right information up front, to submitting that first bill and ongoing billing, and then what are we doing when we're getting reimbursed. It's the whole it's the whole foundation of what we do, but oftentimes that's missed and we just kind of set it out by itself, and then that's when a lot of leakage in that process starts to occur.
Absolutely. Absolutely. Let's talk a little bit more about some just some challenges that typical behavioral health practices and organizations feel. So we've both seen it, revenue cycle management can be a huge pain point for behavioral health organizations. What are the biggest day to day challenges that you see providers facing with their revenue cycle?
I think one of the biggest challenges that many like behavioral health teams faced are that they're forced to rely on tools and workflows that weren't necessarily designed for them. I kind of touched on this earlier that a lot of the RCM platforms were first developed for med-surg providers and family health practices, and really more of that physical healthcare side, and not really tailored to the needs of the behavioral health system. That ends up creating gaps in eligibility verifications, inconsistent documentation, delays in claim submission. And then what I see on top of that is there's like the difficulties for the staff. So often it's, clinical or different administrative staff that in behavioral health care wear 100 different hats throughout the organization. So they've never been trained on the complexities of Medicaid or modifiers or other payer nuances. And that really starts to tangle people up. When it's not their primary focus, they don't tend to put as much support or work into that. And that really creates a lot of revenue leakage that we can come in and then help clean up, and put in those systems in place that really provide that training and that focus, and kind of adjusting to those challenges and complexities that, providers see.
Absolutely. I think those are great insights, especially since obviously I work for Opus. I don't see those day-to-day challenges that people have in provider organizations. So, what are some of the red flags that tell you an organization's RCM system is broken or about to break?
One of the first things that I look at when I go into an organization that's like the number one red flag or telling me something's wrong is when I take a look at their AR. If I see that more than like 25% of an agency's AR is over 90 days, then I know there's something wrong. So in addition to that, then I start to ask a lot of questions. And if the team at that agency can't tell me exactly why claims are being denied, then that's another red flag and another warning sign. So it's one of the things that it's just, why are we not getting paid within 90 days? And if we aren't getting paid and we're having denials, what's causing those denials? And I've worked with a lot of agencies that they just come in and they bill out their claims, they accept what they get, and they don't question anything beyond that. Or they look at it as, oh, these agencies and these provide payer sources, they usually take 90 plus days, not knowing that within their contracts, it's set that they should be paid within a certain number of days. So those are the first things that I go in and look at for the red flags, let me know that something's wrong, and the system needs to be fixed.
Totally. And for somebody who's a layman like myself, what does AR mean?
So that's your accounts receivable. That's what you're expecting to come into the organization. So what have you billed out and what are you expecting to then come back in that reimbursement rate? And so when that amount starts to pile up, then it's taking 90 plus days to get paid. That would be like taking a paycheck that you get and say, oh, you'll get it, you'll get it, you'll get it. 90 plus days later, you still haven't gotten your paycheck, and more paychecks just keep accumulating on top of that. That's a way to kind of explain it to people that you want that money and you need that money to keep operating. So, you wouldn't want that for your paycheck. We certainly don't want that as agencies waiting for the insurance companies to reimburse them for the work they're doing.
Makes total sense. I appreciate the explanation. From your perspective, I guess moving on to some of your insights and perspectives on parts of the industry, from your perspective, what is the biggest misconception that behavioral health leaders have about revenue cycle management?
Hands down, the biggest misconception is that RCM is just billing and coding. That's it. And that's what a lot of people get in this mindset. But for behavioral health, revenue cycle touches literally everything, from intake forms to progress notes to authorization tracking. It's a mix of operational, it's a mix of clinical, there's compliance that's involved. So the leaders that think that RCM is just something the billing team handles are really missing opportunities to drive improvement across the whole organization. And that's one of the great things, and one of the things I've always enjoyed doing throughout my career is helping agencies take a more strategic and agency-wide view of revenue cycle.
Awesome. Thank you. Um, so, what should I guess you spoke on how leaders kind of silo billing and revenue cycle management. What should, as leaders kind of get more involved with the RCM processes, what should leaders actually be asking when evaluating their RCM processes or partners?
That's a great question because I think a lot of RCM leaders, again, they think that billing is just billing and it's out on a silo on its own. And a lot of agencies that I've seen and I've worked with in the past have contracted with billing agencies or platforms, and they just accept what's being said to them. They just accept what is, and that's it. As a leader, you should really be asking for frequency of reports. Hey, how much do we have outstanding in AR? Why do we have it outstanding? And asking questions. So if you have a billing department or you're partnering with RCM service provider, those are questions you should be asking is, hey, can we meet on a monthly basis or a quarterly basis? And can you explain different reporting measures to me? What business operation measures we should be looking at? It's really just getting more involved and not just accepting what is, because once you begin those conversations, then you can start to look at, okay, what do we need to fix internally? Are there things that we have that are wrong with our intake process? Are we having issues from the time we provide a service till the note is entered? And a lot of different things you can start to improve your organization operationally just by taking a look at the RCM measures and KPIs that, are showing how your performance is overall.
Yeah, it sounds like data is really the thing that should drive it. If you don't have good data, if you don't have knowledge about what's happening with your revenue cycle processes, then you really can't make those decisions, right?
Yeah, and I had a mentor in the past when I first started my career that, made the comment that you have to use the data to improve the data. So if you want to see your numbers increase, then we have to take a look at what our data looks like right now, and then how do we build upon that, and what steps do we need to make sure we're improving that data long term.
Absolutely. Absolutely. Wise words from your mentor. What are some of the most impactful changes you've seen organizations make once they start to take revenue cycle management seriously?
Some of the most impactful changes really, and this usually catches people off guard, are clinical practice changes that organizations end up implementing. And a lot of people expect me to come in and say, oh, they find billing codes they're missing, or they find this or that. It's really those clinical operations practices, because we can come in through the RCM process and identify, hey, at the intake process, you're not actually verifying somebody's eligibility and doing a verification of benefits. So you actually now lost out because you didn't get the prior authorization you needed, or you don't have somebody that's dedicated to, documenting the need for ongoing services. So your progress note documentation may improve because you have to start capturing, why does somebody still need to be engaged in our services? So I really think the biggest impact comes in your clinical operations are ultimately going to see improvement, which is directly related to you generating more revenue long term.
Totally. Awesome. I guess since you are on the BHREV Opus RCM Services side, let's talk a little bit more about the approach. So, tell us a little bit more about how Opus RCM Services works with clients. Like, what does a typical engagement look like?
Yeah, so coming on board is one of those things that a lot of people are searching because they're having a problem, right? So they're seeking us out and saying, what's different? What makes you different? Why should we engage with you? And I think that's important to say up front of what an engagement with us looks like, that we aren't trying to retrofit physical health billing solutions. What we're doing with BHREV and Opus RCM, we're designing a platform and services that are designed specifically for behavioral health providers. So then that allows us to use within an engagement once we partner with you, that we can then leverage through Opus RCM cutting edge AI technology to handle like claims faster, reduce denials, improve visibility across our revenue cycle. But then the real results beyond that come from pairing that AI piece with expert human oversight. And so that's where BHREV comes in and makes a big difference, is we can combine those real-time AI-powered tools with dedicated RCM professionals who will actively monitor, help you with correction, escalate issues, and communicate with payer sources on your behalf. And that is the piece that sometimes is often lacking for agencies. They either just working with a platform that is technology based only, or if they're working with billing agencies, a lot of times those billing services are really physical health oriented, so they don't understand the nuances of behavioral health. Between Opus RCM platform and BHREV services, we're merging those two of those together and creating this great partnership that ultimately benefits the end user and the providers that we're servicing, because they get the best of both worlds all in one package, all under one roof.
That's awesome. I really appreciate your insights, especially since, from a provider's perspective, I imagine that it doesn't seem like you would need both, maybe just one or the other, but it definitely shows that it brings a lot of value to have a somebody on your side, essentially helping you to manage your revenue cycle. Even if the platform has these awesome AI automations, it's really good to have an expert there to guide you through it, right?
Absolutely. That's, I think, one of the key pieces. That AI is phenomenal. I don't think any of us are going to disagree with that. There's a lot that we can automate, a lot that we can reduce other costs through the use of AI. But one thing that I have seen providers that have run into is they have this big tool, this robust system that's at their hands, but then they don't know how to interpret anything that, the data that's coming back in. So they have all these systems and resources in this platform, but they're just using it in such a small scale way to where having, the human component allows us to come in and say, hey, you know, you have all these robust features. Let's use those. Let's build upon those. And oh, by the way, I'm seeing some issues here that I think are correlating back to some of your clinical processes. So it just gives you that, outside looking in saying, here's what I'm seeing from your numbers. Let's help fix this. That a lot of agencies don't really interpret when they're looking at the numbers. So it really is a good feature to have in place.
Totally. Like you've got this platform that you pay for, and but it takes a lot of time just to watch how the numbers go. So it sounds like, Alyssa, you are able to spend that time kind of monitoring the revenue cycle and making sure that everything's good to go, and kind of bringing those insights to the clinicians and the providers, right?
Yeah, that's just it. And it's allowing us to do the hard work for you. And that's why we always want to tell people is, work smarter, not harder. And that's
Yep.
one of the ways we can do that is, you keep doing what you're doing on the clinical side, providing good quality of care and services. And we're going to be in the background monitoring everything, making sure, are there areas we could see improvement? Are we going to be the ones focused on your denials? How much time does that take when, a lot of providers that I work with say, yeah, we'll get a denial that comes in, but we just don't have the manpower to send an appeal out within 7 to 10 days. And so then we're just ultimately accepting that denial and writing it off. And it's like, well, what if you have a whole team of people that are dedicated to you that will write those denials for you, send those denials off, kind of follow up and track those denials? And a lot of people go, oh, that would be such a big help. And then we wouldn't be losing out on that money.
Absolutely. Absolutely. That's one thing I like to say about Opus in general is that our whole thing is that we take care of a lot of the, not to say like grunt admin work, but we really take care of a lot of the busy work so that you can spend your time focusing on your patients and improving those patient outcomes.
And I think you just hit the nail on the head is, focusing on patient outcomes. In behavioral health, a lot of times we're working really lean. Agencies and providers, our reimbursement rates aren't like we're going in and we're performing a surgery. So our staffing is oftentimes a lot leaner than those of, our physical health counterparts. And that ultimately usually resonates in the billing departments that people say, oh, I can staff really lean here, but maybe we don't necessarily aren't taking a good look at things, and we're able to partner with you and help provide that resource just to help you keep growing, and really putting you first as a customer of let us take on that hard work for you.
So awesome. Moving on, let me figure out my next question. If somebody is, or I guess, what really sets BHREV and Opus RCM services apart in the RCM space, particularly for behavioral health providers?
I think when we take a look at everything, one of the initial pieces is our ability to integrate. We have under Opus umbrella, we have the HR system, right? And with Opus RCM, we have this ability to pair these systems together that are going to communicate. So if I enter a patient into the HR side, they're automatically going to pop up into the RCM side. And I don't have to navigate all of these platforms, and I don't have to download all of these reports and then upload them somewhere else. And that's problem number one that we solve, is that you have this all-in-one system at your fingertips, everything housed under one entity and one agency, or not working with 500 different people. I think the next thing is that's when we pair the BHREV services on top of it, that not only do the systems partner together, but then we partner with you to keep an eye on what's going on in the system. So what's happening in the RCM process? Do we have delays in the RCM setting and the RCM world that we're not billing claims out as quickly as we should? And if we're not, what's that going back to? Oh, maybe that's because we're not billing out for services until 14 days after a service occurred. And we need to take a look at those things. And we want to take a look at why things are getting denied. And again, I think it just pairs back to having that really robust platform combined with the human services. It's just the best of both worlds, that it's almost like we have double checks all along the system, that here's a check in the EHR, but then it's going to be checked again in the RCM platform, and then it's going to be checked by a set of eyes on the BHREV side, that we are just constantly honed in on your revenue system, that just relieves such a burden on the providers and the agencies.
If somebody who is listening right now is struggling with their revenue cycle management but doesn't know where to start, what's your advice?
I would say start with visibility and honesty with yourself. Take a hard look at the data, and what does it tell you? Are you currently tracking denials? Do you know what your clean claim rate is? And if you feel like that's super overwhelming, like, you don't need to worry. If you're listening right now and you're like, I have no idea where to start with that information, I should tell you to take a deep breath and reach out to us, because that's one of the awesome things that we're doing on the BHREV services side, that we're offering a complimentary audit for behavioral health agencies, where we're going to walk through your revenue leaks and pain points, what systems need attention, and how can we come in and help. But even then, it's complimentary. So it's no, like, you don't have to sign a contract at the end of it. There's no strings attached. It's just saying, hey, let's take a look at this for you. Let's help walk this through you so you don't feel overwhelmed. Because a lot of times I know that agencies get into the system, they start to try and look for things, they get too overwhelmed, and they're like, yeah, I can't do this right now. I'm going to come back to it later. And as we all know, there's always 100 fires every day that need to be put out. So we push it off and push it off and push it off. So that's one of those things. If it feels overwhelming when I tell you to start and just really look at what the data tells you, reach out and give us a call, and we'll help walk you through that.
Awesome. Yeah. Speaking of the audit, if anybody listening right now wants a link to schedule time with Alyssa, of course, I'll include that on any platform that allows me to include a link. So, at the very least, on YouTube, I know I can include a link, but if you're listening on Spotify or Apple, I might be able to include a link. So, now, I guess moving on to some off-topic questions. We like to have a little bit of fun at the end of the podcast episode, right? If you weren't leading the RCM side of services at Opus and BHREV, what do you think you'd be doing? Like, any dream jobs or hidden passions you have?
Oh man, tough question there to just throw at me. But man, if I had to say, like, if I weren't leading the RCM side of things, um, I would probably want to start my own, like, nonprofit, like, recovery cafe style thing, where you have access to behavioral health providers, peer supporters, different community members, that everybody kind of comes together for some mentorship, some training, and ultimately, like, a good cup of coffee, because anywhere can go in and maybe has a pot of coffee that was brewed at 7 a.m. and hasn't been touched when you get there at 1, but who doesn't want a nice cup of iced coffee in the afternoon. So I think maybe that's what I do, partner that together. I've always been passionate about the behavioral health field, so I definitely want to find some way to remain in there. But I also love a good cup of coffee, so maybe that's how I would merge my two passions there.
Fair enough. Fair enough. It sounds like you are really in the behavioral health space because you love it, and that's a great thing to
Yes.
hear. So,
Yep.
um, we always ask this question, but any books or podcast recommendations that you love, either professional or just personal favorites?
Yeah. Professionally, one of the podcasts I've listened to is the Checklist Manifesto. It's a pretty good one. It kind of shows how processes can be structured, and when those structured processes are in place, how ultimately that can then like save lives and resonate in that piece. So it's just I think a good one to listen to. Oh man, for I think for maybe some more fun and insight. I don't know. I love there's a podcast called Work Life. There's another one called Where There's Smoke. They kind of dive into the psychology behind decision making and leadership. And, I oftentimes get asked, like, what type of leader are you? And it really kind of dives into why you lead the way you lead. And I've always thought that's really interesting. So I think those are the ones I'd recommend.
Awesome. I personally, I'll definitely check them out. I'm a huge into those kind of books. I don't listen to a lot of podcasts, ironically, but maybe I'll have to start. So,
Yeah, I'm a mix of both. I like to read and I like to listen. So, but yeah, those are some good ones to check out.
sweet, sweet, sweet. And of course, if people want to schedule a little time with Alyssa, I will link it in the description if available, or if you check us out at opusehr.com, there's a form to contact us that'll actually connect to my inbox directly, and I can assist you there. Alyssa, it's been so great having you here. It's been such a valuable conversation, especially for our listeners. So thank you for being here and for the work you're doing to keep behavioral health organizations financially healthy. I'm sure this will resonate with our audience. And again, thank you so much for your time.
Yeah, thank you so much for having me.